Okay, so what I wanted to talk about today was labour, really, because what came up out of last week's session, which we were focusing on the pelvic girdle and strengthening the pelvic girdle, but then what came up in the chat afterwards was a lot of labour, labour. So what I wanted to do today was kind of talk a little bit about labour, really, and sort of put your minds at ease. So in these classes, we will go over all of the things that will potentially give you a much easier birth. Okay, so posture in labour is really, really important. So the position that you adopt in labour is really important. Lying on your back, as you see everybody, every drama you've ever watched, every live birth, everyone born every minute you've ever seen, the mum is usually on their back. This is the worst position for labour, and it all comes from the position of the birth canal. Did you all read the little booklet that you got sent? Anybody read it? Yeah, it's quite interesting. I was reading it again today, and there's loads of typing errors in it. All the links are wrong because that's really old, and of course I haven't done this for 20 months, and I realised all the links are wrong in there, so I'm going to redo it and with all the right links in. But I talk a lot about the pelvis and the position. There's also a really long blog post on the website which talks about the best position for labour. So when you're birthing, whether it's stage 1, which is opening the cervix, and that's the longest bit, stage 1 just goes on and on, and you're just waiting for that 10 centimetres. Whether it's stage 1 or stage 2 for pushing, the best positions to adopt are ones where your body is in natural alignment with the downward flow, the downward movement of labour, and the kind of downward trajectory of your baby. So if you're lying on your back, your baby is effectively trying to go uphill over your tilted sacrum. And if you're on all fours, so this is the position. So this is what I said last week. Most of what you do in this class is going to be spent here, and we're going to spend a lot of time just doing nice stretches and poses on all fours, but also kind of adding in a few birthing moves as well, because this is the best position to be in for any stage of your labour. So there's the all fours position. There's also sitting on a birthing ball for some of it, because again you're upright. Squatting's really good, being in a birthing pool is really good. The only thing you want to avoid is lying on your back, and that gets a little tricky because it's often the position that you are put in by default because it's easier for the medical staff, but it doesn't matter if it's easier for them. What matters is you have an easy, stress-free labour. So the position that you're in is really, really important, and I'm going to spend a lot of time reinforcing that, and we're going to look at all the different positions that you can do during your labour. I also do a session on birthing balls. You remember last time we just get all the balls out, they're all in that cupboard, and we'll have a whole session on birthing balls at some point, again, as we get nearer to your due dates. And we're going to look at how can you use a birthing ball. What do you do with them? Great big rubber ball. What do you do? So we'll look at all the different postures and positions that you can use for that. And of course, the breath is really important as well. So the breath is one of the fundamental tools that you will have during labour. Because when we have control over our breath, we have control over our mind. And that's really important, because what's the number one thing that you're probably worried about in labour? Losing control, yeah? Being out of control, not being able to be in control of what's happening. So when you're in control of your breath, it gives you more control over what's happening, but also it stops you from panicking and becoming anxious. So the breath will help you. So again, we're going to go through lots of different birthing breaths. We did the Ha breath last week. We're going to do the B breath today, which is lovely and calming. And there's quite a few of these different breaths that you can use throughout labour. And that, I think, is again really fundamental to how you feel during your labour. It really does reduce the amount of anxiety and stress. And I also think just coming here week after week after week and just becoming more confident in your ability. Because actually what happens in the West here, particularly in regards to anything medical, particularly pregnancy, And also, parenthood as well. I'm sure you've all had tales, haven't you? Parenthood, where your abilities are doubted all the time. Medical professions know best. You don't know anything about your baby. We get this quite a lot as well. And there is a need for that. Obviously, I'm not sort of at all saying that we don't need the medical profession. But in amongst all of that, you are powerful as well. You understand your body. And so coming here every week, learning breathing practices, learning movements, learning postures, learning to trust yourself a little bit more, learning to tune into your body will really make a difference into how you feel when it comes to giving birth. And you just have to trust me on that. This is your second week, so you're probably thinking, oh, I'm not sure about that. But, in 10 weeks' time, you might be feeling a lot different. So has anybody got any specific questions about, what worries you most about labour? What's your biggest worry? Pain. Yeah, that's the number one, isn't it? It's the number one thing, But again, working with the breath and being in a better posture can help. One of the things with the pain is that it's interestingly the birth pains are in the lower back, they're in the sacrum, because that's the biggest plexus of nerves that we have that feed the whole of the lower abdomen. So if you think, if you know anything about sort of anatomy, that all of the nerves come through the spine, come through the centre of the spine, central nervous system, the spinal cord, and then they branch out between each of the vertebrae of the spine, and then there's a big bundle of them at the sacrum. So I'm going to bring my pelvis and keep saying this one of these days, but this, we talked about this last week, sacrum here, this bone, this flat bone at the back of your pelvis. Well, there's a big plexus of nerves here, and they feed all of the organs in the lower back, in the lower abdomen. So if you're lying flat on your back, you're lying on that. So you're already providing pressure, and your baby is lying on top of it from the other side. So you've got pressure both sides onto that bundle of nerves. However, if you're in this position and you're making some movements with your pelvis and you're freeing it all up, your baby is pulling away from your pelvis. But also movement helps to dissipate it. So if you think about it as well, when if you hurt yourself, if you bang your knee, do you leave it or do you try and move it? Yeah? Anytime you have pain, you want to move the area, don't you? If you hurt your finger, you might do that. You're not going to hold it, so you go, I've hurt my finger. But that's what we have this image that we're expected to do for 12 hours or whatever during a labour. So that's why moving is better, because it dissipates the sensation. Rather than it being centralised in the sacrum, it dissipates it because you're moving the pelvis. Whether you're sitting on your ball, whether you're in the pool, or whether you're just on all fours, whether you're standing. Lots of positions that you can move the pelvis, but that's the main thing, move the pelvis. And then the breath as well, as I said, the breath can be quite a good pain relieving mechanism. Just that being in control of the breath reduces panic, reduces stress, and that again leads to less pain receptivity. What's the other thing about pain? Yeah, and also wear birthing pool. Yeah, I mean the number one thing for pain relief is actually being in hot water if you get the opportunity. So I would look into things like birthing pools. Actually, I don't know if they've opened the one at Burton. Are you all going to Burton? Where are you having your babies?
Good Hope.
Good Hope. Have they got a birthing pool?
Okay. I think so. They're just already done.
Yeah. See, a lot of them shut with COVID. Like everything else. We've got to do something. Let's shut everything down. So they shut the pool. Yeah. So a lot of them weren't open. So that might be worth checking it out actually. So birthing pools are brilliant for pain relief. Everyone else, Derby. Yeah, so Derby, especially if you get into the midwifery bit.
No chance.
No chance. Going straight to the
straight to the medical line of it, unfortunately.
Okay, so they probably haven't got your birthing pools then.
I wouldn't do that.
So you're going to have to rely on your posture then, posture and breath.
Because I'll be most likely induced and I've had a section.
VBAC.
So I need to be quite careful.
Yeah, that's fair enough. No, they don't like having a water birth after a VBAC actually.
No.
I didn't know that.
Because if you're induced, you can't. They need to check how strong the contractions are and whether there's any risk of it rupturing.
Right. There's no chance of me having a water birth. For a C-section.
So you a VBAC as well?
Yeah.
I believe no, but because I'm older as well, mine's more risky as well.
I'm more than likely being induced as well first.
Yeah. So with an induction, yeah, as Claire was saying, there's a lot of monitoring that needs to be done. In Claire's case, obviously, and likely in your case, if you do become induced, is that rupturing, but also because the induction is really rough on the baby, because you go from 0 to 100. There's no kind of gentle speeding up of the process, which is what naturally happens. And it starts with a little twinge gets a bit stronger, and then you and your baby get used to the progress of labour, whereas induction is just like you're straight in there, and so it's a bit of a shock. And so one of the things that they want to do is actually check the baby as well, and they can't really do that if you're in the water. So that's why you won't be able to have a water birth with an induction. But there are other things you can do, like just keep moving as much as you can. Are there any other burning worries about labour so far?
All of it.
All of it. Okay. Yeah, we'll ask questions as they come up. So not when we're in the class, if anything comes up, you know, this is actually something that I'm really concerned about, just ask, and we'll see if we can find an answer for you. Okay, so is there anything you want to work on today? We're going to obviously do a bit of Rebozo work. So we had some pelvic girdle tightening, and then we had some it was round ligament pain. So are those people here? Round ligament pain, yes. You're here, good.
I was SPD and both.
You need two then.
Everything.
I need to wrap both at the same time. Yeah, so that's good, yeah, because obviously if no one's here who have those issues, we can do something else. So yeah, we'll have a look at that then. So we'll do some binding or Rebozo work, as it's sometimes called. Is there anything else you'd like to do today? Any just sore bits, stiff bits, mental bits that need addressing?
A bit of everything, really.
I think something for the legs as well, because I feel every time I go to bed at night, that's when my legs just ache, and just nothing that I feel I've been doing, it's just easing it.
I get restless leg syndrome as well.
Yeah.
So.
Very, very irritating.
Yeah, it's really common, or fizzy legs.
Cramps,
yeah,
in my calves.
Now that we can fix easily. 100% guaranteed we can sort that out. So yeah, we'll do the cramp stretch.
It has got better because I've gone on to iron tablets and insulin and metformin and whatever else, and it's actually got better since I've taken medication, but it's still there. So
yeah.
Yeah.
So there it's the same kind of fix really, fizzy legs and cramp. It's kind of all part of the same pattern. So yeah, we'll have a look at that. We'll do some leg stretches. And what I always say is anything that happens in the middle of the night or when you go to bed, the fix you do before you get into bed. So these leg stretches that we'll have a look at, do them before you get into bed. You know, you're ready to go to bed, teeth clean, pajamas on. Just do these stretches, and then it does stop the cramp. And again, it should stop the restless legs as well. It's just a lot of energy kind of like held in the legs, isn't it? Because again, we're not very active, just generally anyway. But especially if you've got a sedentary job, so all the energy that you would normally use and dispense with during the day, if you're sitting all day, you can't. And then you might have gone to the gym or gone for a run previously. You can't do that when you're pregnant. So anything that you used to do to kind of disperse that energy, you haven't got anymore. So the three things that they say to do for pregnancy: walking, yoga, swimming. Those three things. Because anything else really is just too much of a strain on the body. And again, if you're getting fizzy legs, and so what I used to say to some of my ladies, particularly if they're having this, if you haven't got any children at home already, have a walk in the evening, like a 10 o'clock walk. If you have a dog, it's a really good. Go and get a dog before having a baby. That's a really good idea. But obviously, you don't want to walk around on your own at 10 o'clock at night. So I always recommend that go with your husband, your partner, whoever that you live with, or find a friend to go with. But just get that, stomp it out before you get into bed. So if you're getting any fizzy legs, that's a really good idea. But I'll show you these stretches as well. Okay, all good? Right, can you come into a comfortable seated position? So if you are struggling with SPD, pelvic girdle pain, as we did last week, if you're not comfortable sitting cross-legged, you might want to sit with the legs out straight. Cassie, were you yeah. Did you use this last week?
No.
Do you want to use it?
If that's okay.
So this is, did I bring it last week?
Yeah.
I did, okay. So when you're sitting, you can grip it, and then that's going to work your adductor muscles so that you can...
I did look at getting one, I'm just waiting for payday, so...
Yeah, end of the month. So
They're
when
not very expensive actually, they're like £5 or something.
yeah,
so.
and they are really quite versatile actually. Yeah, so you can either sit cross-legged if you're comfortable. If you want to work the hips a little bit more and you don't have SPD, symphysis pubis dysfunction, bring the soles of your feet together and work more into the hips. So that's another option. And again, if you sit comfortably up against the wall, if the hips are quite tight, sitting back against the wall will give you a little bit of support. Okay, and then just take a moment out of your day. So just bring your body into a state of stillness. And just take a moment to move your awareness around your body. Noticing how your body feels. Being aware of any areas of spaciousness that you might feel in the body. And at the same time noticing any areas where you may feel a little congested. Just noticing any changes that may have happened this week. So when we have these very common changes in our body, these very common things that happen during pregnancy, they often happen overnight. So you might be aware now maybe of movements. So bring your awareness down into your belly, into your baby. And just fix your awareness on your baby for a moment. Become aware of their presence. Be aware of the sensation of your baby sitting inside the center of your body. And then notice if they are giving you any movements. Is there any gentle flutterings, any pulsings? We might have bigger movements. And then we're going to turn our awareness to the breath. So become aware of the feeling of the breath as it moves in through the nose. And become aware of the feeling of the breath as it moves out. Now, one of the things that often happens in pregnancy is a bit of congestion around the nose. So notice if there is this slight stuffiness in the nostrils. And then as you continue to focus on your breath, I'd like to invite you to work with the second of our birthing breaths. So this breath is known as the B breath. And it's very simply humming on the out breath. It's a very simple breath, but that simplicity belies a wealth of benefits that we can get from this breath. So all you're going to do is hum as you breathe out. So I'll start. You can hum anytime you make your out breath. Don't worry if you're not in time, we're not trying to create a choir here, so you might find that you're humming on your own at some point, but just stay true to your own breathing pattern. Going with the breath, and we're going to add a little bit of arm movements in. So when you next breathe in, let the arms reach out to the sides and up over the head. And as you breathe out, still using that B breath, you're just going to bring your hands down the center of your body, and if you've got any B left at the end, you can just rest your hands over your baby right at the end of that breath. So it'll look like this: breathing in, breathing out. Just noticing how that feels. So there is a real quality of calmness that comes with this breath. It's one of the ones that we use a lot in yoga for preparation for meditation, because it brings you into this very quiet state of mind. It's a brilliant one for any anxiety, any stress. And then just gently lift the legs up if you have your legs crossed, and then just give you a little stretch out in front. So we'll work through the toes, give the toes a little bit of a wriggle, stretch the tops of your feet away, push the heels away, stretch the tops of the feet away, pull the heels, do that a couple more times. And we're going to rotate the ankles around, so circle all the way around. And then rotating in the opposite direction. And give the legs a little bit of bounce. So one of the things that you might have noticed when you were doing your B breath is that your baby might have woken up. You know, if you did to do it for a longer period of time, you might actually find that your baby becomes very stimulated. And they get very calmed and soothed by that sound, particularly if you do it a lot over your pregnancy. They kind of get used to that sound. And what we've noticed in the classes is it can reduce the fetal heart stress, reduce, when the fetal heart rate goes up. It can reduce it a little bit by actually doing this bee breath during labour, because it's calming for you and it's calming for the baby as well. So I would recommend you do that one a lot, and especially if you can't sleep at night, sit and hum. It'll drive everybody mad. It doesn't matter. You are the queen of the house. You are pregnant. Okay, so let's come over onto our hands and our knees, and we'll have a look at some of these birthing moves. So,
should I keep this on hands and knees as well?
Depends how you feel. I think when we start moving the hips, it might fall out.
Okay.
So I think it's a case of just
See.
if you think, and if you're feeling a little bit unsupported, I'd keep coming back to it. But there may be times, so we'll do some
See how-
lunges as well. So I don't know how you are with lunges. We'll find
I'll
out.
try.
Yeah. So it may be that when we do the lunges, when we're in this position, which we're going to do shortly, if that's not comfortable, what you could do instead is that with the ball, and just do whatever we're doing, but from that position.
When I'm on my hands and knees as well, I've got a ganglion, so it does hurt my wrist sometimes. Have you got any sort of?
Yeah. Now, do you know what? Pre-COVID, I had wedges. So they were made out of this stuff. I had a bag full of equipment, and they were like that, but they were a wedge. And they were
So
really
you
good for
have
carpal tunnel,
Yeah.
because what you want to do is you want to reduce the angle.
Yeah.
So what I would suggest is, depending on how much of an angle you need,
Blanket or something.
you just need to roll something up. Yes, you maybe roll your blanket up into a long thin sausage, and you just want to put the pad of your hands on that, and then just let the heel of the hand
So
lift up. How does that feel?
yeah, that's better.
Yeah. So what we want to do is we want to basically, because normally for most of us, you
Yeah.
can see Claire's demonstrating beautifully, most of us are at a right angle.
Yeah.
I
So-
can't actually do that for that long
And I
though,
can
so I end
do
up
it.
doing that
Yeah.
sometimes just to
I
ease
can
it
do
a
it
bit.
for a bit. It's just then it
Yeah.
starts to hurt.
Yeah. So if you've got any sort of issues with your wrist, and also women get a lot of carpal tunnel in pregnancy. So again, people they can't put their hands straight down. So that's why these wedges were so
Just a-
good. But I got rid
Just
of them.
slightly. Okay.
Got rid of them because we weren't allowed to touch anything. Okay, so you're going to come onto your hands and your knees, and you make it as comfortable as you can. So you want space for your baby, you want your spine to be nice and long, and then we're just going to start with some circles. So just moving the hips in a circular movement. Try and make the circle as big as you like. So this is a horizontal circle. So we're moving, the hips are in the same plane, we're just rolling the weight around from one hand, then one knee, then the other knee, then the other hand. So in addition to this, if you could add in your bee breath and notice what happens to your movements. Change the direction and go the other way. End of your next breath, end of your next out breath, you can let go
And then just make a space between your knees for your baby. Roll your spine to the ceiling, so make it as arched as you can. Keep it arched, and then just gently ease the hips all the way back onto the heels. And just maybe even a little wriggle from side to side. So it's quite nice for the lower back if you just rock your hips here from side to side. And just feeling the length in the spine, so releasing any tightness across the lower back, but also across the upper back as well. So you might feel a bit of a stretch here around your shoulders. And then just slowly walk your hands all the way back. So that first move we did is like a very basic labour move, and the idea is that you would do that every time you had a contraction. So you move your body, so it helps the cervix open more quickly because you're moving, you're dispersing the pain of the contraction, so it's less intense. You've got something to focus on, and also you're in control. So imagine the difference. You're having a contraction, you're lying on the back, it's happening to you, or you're having a contraction, you're moving and you're breathing and you're humming. Can you see the difference? You're in control here. You're kind of driving this, and so it makes a really big difference whether whether you're just sort of lying back or whether you're making these moves. And it speeds the labour up. So this is what's known as active labour or active birthing. So you might have come across this phrase before. Basically, active birthing means that you're an active participant in it and you're actively moving, actively breathing, adopting postures to help the labour. And this is part of it, this kind of like moving, using the way that the body works to help you in your labour. And we have to kind of look back at, the ancestors. It's only in the last sort of 100 or 200 years that women have started lying down on their backs. Prior to that, they would have been on all fours on a birthing stool and squatting. Job done, back in the field. It's only recent medical interventions that have put women on their backs. And then, we have longer labours and all kinds of things. So that will come back every week. We do this, all fours, hip circles, and then some kind of breath work as well. So it'll kind of end up being like a bread and butter move for you. But that is your first tool for labour. So now coming back onto all fours, and we'll do some of these leg stretches. So take the right leg back and come onto the ball of your foot and push the heel away. So we're going to actively push the heel away. Now at the same time, just push into the heels of your hands as well. So you're creating a little bit of tension. So you're not pushing all the way back. Now you're going to hold it until the intensity goes away. So when we first start the stretch, that calf muscle is likely to feel really, really tight. But then if you hold it for long enough, it kind of eases off, doesn't it? So you might get to a point where you think, that doesn't feel so bad now. And that's because you've eased it off. So from here, can you cross it behind the left leg and squeeze the thighs together? So that's a good strengthen. So the right leg is still straight, but you're crossing it behind the left thigh, and then you're kind of gripping the two thighs together. And then we're going to lengthen the right side of the body. So you're going to draw the right side of the ribs around and over to the left side. And just see if you can look back and see your right foot. And then take a slow breath here and feel as if you are filling up all of the right side of your lung. The right lung, the right side of your chest. So strong breath in, expanding into the right side of the body, and then you can bring the chest back to the center and bring the leg back. Now we're going to slide the knee forward, so Cassie, take a bit of care here. Was there somebody else with SPD? I think there was a couple of people, maybe one's not here today. So see how this goes. If it's not right, then you could do some the leg drop that we did last week. Okay. So you're going to slide the right knee forwards between your hands, and stretch the left leg behind you. So this is a nice hip stretch, but it's also stretching that back quad. So you walk your hands back as far as you comfortably can, and then you're just going to drop the right hip over to the right side and the left hip over to the left side. So just easing from one side to the other. So again, opens the hips. There's a bit of a stretch to that back quad. So that's the quadriceps are often the tightest part of the body because we sit a lot, and that tightens them. And we spend a lot of time walking and sitting in cars and things. So this is quite a nice stretch for the quad. If you're not sure where the quad is, it's the four muscles that are at the front of the thigh. So on this side, we're stretching on the left leg. So the left leg is getting the quad stretch. And then from here, just pushing all the way back. And then we'll go back into those birthing moves. We're going to circle the hips around, and we're going to go back into to the center. Make a space between your knees for your baby. Roll the spine to the ceiling, round the back. Ease all the way back onto your heels. Little sway from side to side, and just release your wrists. So come onto your elbows. Rotate the wrists around in one direction, and then in the opposite direction. Okay, so then from here, push your shins into the ground, and that'll rise you up. So see how you can use the ground to push into. So coming back into the all fours position, we're going to do all that on the other side. So the left leg extends back this time. Stay on the ball of the foot, and then gently push into the heels of your hands. So we've got a little bit of a two-way stretch there. So you're pushing the heel away. And again, just noticing initially there's this feeling of tightness and intensity in the left leg, and then eventually it starts to ease off. And then slide the left leg across towards the right side. So now it's crossing behind your right thigh. And then grip the thighs together if they are touching. And then we're going to turn and lengthen the left side of the waist. So draw the left rib cage away from the pelvis and lengthen through that side, and look back at the toes of your left foot that are over on the right side there. And then you're going to take a long, slow breath in and feel that you're making space across the left side of the body. And then slowly bring that leg back. So now you're going to slide the knee forwards between the hands, and then again just rocking from side to side, so feeling that stretch down the right quads. Is that okay? Pelvis right there. Then from here, just pushing into the hands so that the knee slides all the way up. And then tuck your toes under and just see if you can come back and sit on the tucked under toes. It will feel a little bit uncomfortable, a little bit painful, so we're just going to hold it for a little while. And then from here, you can push into the ground with your hands, let the knees come up. And then drop the heels. And just dangle for a moment. So make a space for your baby here. So you might want to take the feet a little bit wider. And just dangle everything forward. So bend the knees, particularly if your hamstrings are tight. So don't feel you have to have the legs really straight here. We're using this position to lengthen the spine. So let go of your head. Let go of your shoulders. Now if you've got very high blood pressure at the moment, you might want to come up sooner rather than later. If you've got low blood pressure, you might enjoy this opportunity to get more blood into your head. So you choose when you want to come up, and when you do want to come up, you bend the knees even more, and you push the feet into the ground, and you uncurl. Come up slowly, particularly with high blood pressure.